Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive care from a qualified chiropractic doctor for both appropriate diagnosis and treatment, both today and tomorrow. That's also why BC's chiropractors are funding research and education. Today, I'd like to introduce you to the topic of quality research. When we talk about research and you hear about the latest research, it's normally in the headline of a newspaper, a television news report, or maybe some print journal, or even as I'm talking to you today. One of the things that you need to spend time on is to look between the covers of the research. You will have to do a little bit of reading from time to time. We have had all kinds of historical examples when research came out and somebody said, do this or take that, and it works, only to find out 5 years later that the research was flawed, the research may have been biased, may have been inappropriately influenced, or the wrong people did the research and the bad data was reported. So what do you do about that? Well, you're going to have to take some responsibility. If the information on the research rings true to you from your own personal experience, that's an important clue. Likewise, if something doesn't sound right, you're going to have to do some reading. Now, the good news is that the internet today, on any of the search browsers, put in only 2 or 3 keywords and it pops up. But here's the clues for you. Take a look at the title of the research. See if you can read that the research actually investigated what was proposed. And in the case of spine and spine-related research, make sure that the qualified people to deliver the treatment actually were the right ones. Go to the end, what is called the bibliography, and find out if those sources are recent, 5 to 10 years old, or if they're 10 or 20 or even 30 years old. Because in those cases, all we may be doing is repeating the past mistakes and putting a new date on them. So research and quality of research is vital, not just to the doctors you see, but to you, the public. You have to become an empowered healthcare consumer. Just as you're knowledgeable about everything else you use and buy in life, you're going to have to become knowledgeable about what the research is that we in healthcare use to help you get better. As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow and better healthcare outcomes for you.